This is a picture of me and my good friend Russell. When Russell passed away, I went to his funeral and sat in the church, and I was feeling absolutely miserable that I had lost one of my best and closest and dearest friends. As I was sitting there feeling so bad about the loss of my dear friend, they had a slideshow, and in the slideshow they showed this picture of Russell and I. And I was mortified. All I could see was how big I'd become. I didn't even realize I was that big. I started having weight problems when I hit adolescence. I started gaining weight and doing diets and Weight Watchers and exercise and just battling through things frequently. Diets and tried to exercise and to get through my 20s where I would go back and forth on diets and exercise and trying to get weight off and having more come back on. And it just became a cycle. And this became pregnant in my late 20s. I gained a tremendous amount of weight.
Some of the most common health issues that come with being seriously overweight would be diabetes, hypertension, sleep apnea, strain on the heart, fatty liver, joint issues, arthritis, obesity on the lung function.
I now had hypertension. My weight was over 200 pounds. On top of things, in 2005, I had a serious fall.
And very quickly she found that she just simply could not exercise in any kind of regular way, and so of course the weight is piled on over a short period of time.
That's when I realized that my weight had to come off.
She decided to take some initiative. She learned a lot about the idea of having surgery to help reversal of this. She came and saw me, and we both decided mutually that she would be an excellent candidate for a gastric bypass. We would create a small stomach pouch at the top of the stomach that would be less than an ounce in size. We would then divide the small intestine and bring one end up to connect to that small stomach pouch so that the food can come down directly into the small intestine and bypass the rest of the stomach. And then further downstream, we connect the small intestine back to itself so that the digestive juices coming from the pancreas and from the liver and the gallbladder can be merged with the food stream.
Well, there was one day that I had a meeting, and of course I was running late, and I was on the 6th floor and the meeting was on the 10th floor. And I get to the elevators, and lo and behold, it's out of order. And I see the stairwell, and I think, well, I've been doing regular exercise, maybe I can do this. It's 4 flights, but maybe I could get there. Not only did I climb the 4 flights of stairs, when I got to the top and step out onto the 10th floor, I realized I'm not winded, I can breathe, I can talk, and it was truly a life-changing moment. When I had the weight on, I had terrible knee pain, terrible joint problems, and terrible sciatica. I was walking with a cane, so I could never have considered just 1 flight of stairs, and here I did 4. By 6 months after my surgery, I had lost over 75 pounds. It just was a tremendous boost to my ego. I felt fantastic and realized that I had a lot more energy and a lot more stamina than what I had ever imagined. That's when I decided to actually introduce a regular exercise program into my life. I decided to try jazzercise. I had done this years ago. I had enjoyed it, but because of so many health issues from my weight, I wasn't able to keep it up. It gave me another avenue, another support system, and plus, I was actually able to do it and enjoy it. All of a sudden, there were no obstacles. I could just keep going. I couldn't believe that my life had changed so drastically from where it had been just 6 months before. The doctors and the services that the medical faculty associates provided to me really helped me change my life.